Hello everyone, welcome to Vojdani episode 7. This is our video informational series where we talk the latest and greatest in the world of immunology and functional medicine. I am Dr. Elroy Vojdani. I am the physician founder of Regenera Medical, which is my practice here in Los Angeles. And my guest, as always, is my father, Dr. Aristo Vojdani. He is the Chief Scientific Officer for Cyrex Labs and known by many as the father of functional immunology, a tremendous wealth of knowledge with everything related to the immune system. Thanks for joining me again.
Thank you, Elroy. And I would like to start by congratulating you first for becoming a father.
Thank you very much.
Secondly, because of you, I became more active in the field of functional medicine. As you know, the first functional medicine was in 1992. In Maui, I participated in that, and I was very active. But, you know, throughout the years, I became a little bit less active, but as soon as you became, certified and participating at IFM, I became more active, and therefore, the subject that we are going to talk about, which is Alzheimer's, is thanks to 2016 participation of IFM in Los Angeles, which we had the best presenters in the field, as you remember, Dr. Tanzi from Harvard,
Dr. Bredesen, Dr. Perlmutter,
and many more.
All friends of yours.
Yes. So it was thanks to you by becoming interested in the Institute of Functional Medicine and what they were offering that we started participating again at the Institute of Functional Medicine annual meeting, where we met the greatest scientists who were presenting different topics about the brain.
Right.
Including Alzheimer's.
And it was, I remember Dr. Tanzi's lecture in particular, where he was showing electron microscopy, showing basically that there were toxins from bacteria in the center of the plaques of Alzheimer's disease that sparked, I kind of saw the spark happen in person, where you were like, wow, we need to get involved in this research.
Exactly, yes, thank you, yes.
So now we're at the culmination of, maybe 2 years worth of research to this point, where we have just finished publishing 3 articles in various journals about our work in the last 2 years in regards to Alzheimer's disease.
That's right.
And this episode is really part 2 of our overall discussion of Alzheimer's disease. And in part 1, we talked about the fact that the way that we in the medical community are thinking about Alzheimer's disease has been changing a lot in the last couple of years because of this research. We've shifted from the idea that we need to put all of our efforts into discovering a single drug that can cure or reverse the disease after 80 to 100 failed drug trials, now thinking that maybe Alzheimer's is not one disease, but maybe the end accumulation of many diseases that, which is what our inspiration was, what we wanted to look into, what our research was really focused on, was discovering what all those many things that contribute to Alzheimer's disease might be, correct?
Yes. So you and I reviewed at least 500 different articles from scientific journals.
I have the folder over here.
Yes.
Let me grab it real quick.
Yeah.
So this is our folder of, I think, all the scientific journal articles that we pulled from the literature that have already done very significant, substantial work looking into the effect of infections, chemicals, foods into the pathogenesis or into the process of developing something called beta amyloid plaque, which is the hallmark of Alzheimer's disease and other dementias.
Yeah. Actually, most of these articles were about the role of pathogens and toxic chemicals.
Right.
And food actually is our contribution.
Yes.
It wasn't even mentioned a single food other than Dr. Bredesen that just removing gluten and dairy help in some patients. But we didn't have any scientific evidence that gluten and dairy possibly involved in Alzheimer's disease.
Until now.
Until
our work.
Exactly.
Yes.
Yes.
So let's take a moment and talk about these 3 articles that we published, this work that we're doing in the world of Alzheimer's disease. essentially after going to this conference in 2016 and looking at all of this amazing advanced research going on in the world of Alzheimer's and other neurodegenerative diseases, we decided to investigate, knowing that Alzheimer's disease has a 15 or 20-year lag until symptoms are present. Let's see what we can detect 15 or 20 years before, what might be going on inside of the body, what might be predisposing someone, and try to understand how this molecule, amyloid beta, which is the hallmark of Alzheimer's disease, which causes the issues with the neurons in the brain, how this molecule is formed, right? So
Yes.
there's some research that was done ahead of time that said, you know, our thoughts about beta amyloid, this molecule, this protein fragment in the brain, is very different than what we thought before. We used to think that we deposited this molecule by error in the brain, and maybe there were genetic factors that predisposed someone to depositing this beta amyloid in the brain. And if you were one of those people, you were going to end up with Alzheimer's disease, right?
Yes, and nothing we could do about
Nothing
it.
you could do about it, right?
That was my understanding.
Right,
Believe me, as an immunologist, I'm not a neurologist, up to 3 years ago.
right. But that has completely changed.
Yes.
And that's because we've discovered that this molecule beta amyloid actually has some function. It is actually an essential part of the immune system of the brain, right?
Absolutely.
So it has
Yes.
some function to attach itself to dangerous things like bacteria, toxins, and it serves to bind them, and its real goal is to try to protect you from these toxic effects.
So in couple words, amyloid beta acts like antibiotic in our brain.
Right,
When there is inflammation or any pathogens, toxic chemicals, or even food or antibodies get into the brain, immediately those antibiotic-like molecules are released in order to prevent inflammation in the brain.
and that's really fascinating research, right? Because our whole world in the medical community is flipped upside down. Or the way of thinking about what this molecule, this protein fragment is doing completely changes. And it starts asking new questions, right? And those questions are, well, if this is a protective molecule, what is it protecting us against? And you mentioned bacteria, toxins, but you know, those were mostly theoretical. We didn't really have a map exactly as to what those things might be. And well, then, if it's protecting us, where are the genetic variants in people's ability to form this protein? Or some people, do they have systems built in their brain where they're more prone to the formation of these things? And it turns out, and Dr. Bredesen has been very involved in this work, that based on your ApoE genetics, you are more prone, if you're ApoE44, which is a certain subtype of ApoE genetics, you are more prone to the formation of this beta amyloid, right? So our work is really focused on the why. Why is this protein functioning, and what is it reacting specifically to, not just in theory, right?
Yes. Let me add another piece of information. It is interesting that the amyloid beta produced in the brain like antibiotic, and if it's not enough produced by the brain communicates with the gut, asking the gut bacteria to produce the same amyloid or the same antibiotic, sending it to the brain, help the brain to fight the inflammation, the pathogens, the toxic chemicals. So it is interesting. This is the best way to show collaboration between gut and the brain.
Wow. So yet again, here we have another disease process, Alzheimer's disease, where we are finding out that there is a significant beginning of this process that actually happens within your gut.
Yes,
That the gut is really the center of so many diseases, Alzheimer's included in that.
that's right.
Right. So we published 3 articles, right?
Yes.
And you know, to give a quick summary as to what those articles might be, the first one was looking into what the function or cross-reactivity might be between amyloid beta and different bacteria, viruses, and their associated toxins, right? To try to map out exactly which of these specific things is beta amyloid binding to. Our second paper looked into toxins, specifically environmental toxins like aluminum, and also foods. So let's try to find out if this protein molecule is actually protecting us against other things in our environment other than bacteria and their associated toxins.
Yes.
And our third article was looking into, well, if we have some circulating autoantibodies in our bloodstream, where's the overlap between those and beta amyloid as well? So that was really the focus of our three articles, was to look at, all these various factors, map out the reactivity between beta amyloid and these various environmental factors. So I know you have the title of our first article really ready to go, and I think that was a humongous amount of invigorating findings for us, because the connections between specific parts of bacteria and beta amyloid were really coming to light. So why don't we talk about that article?
So, always the title of the article is going to tell us the story.
Right.
That's an art, how to give a title to an article, that title will summarize like 10, 15 pages, which is the results of 6 months or 1 year, sometimes 2 years of research. So the first article, the title is Reaction of Amyloid Beta Peptide Antibody with Different Infectious Agents Involved in Alzheimer's Disease.
Right.
That by itself is telling the story.
Right. So essentially what we're doing here is taking the understanding that there's this abnormal deposition of this supposedly protective protein that happens 15 or 20 years before the onset of the severe symptoms of Alzheimer's disease. We want to find out what the function of this protein is, what it is cross-reacting with, what it is binding to. So in our normal immune function, when we're exposed to different things like bacteria and their associated toxins, we form antibodies to them. It's kind of like our army developing missiles specifically targeted against these things to help us defeat them. And those antibodies will go around and circulate within the bloodstream. And what we wanted to see is, potentially, if those antibodies happen to make their way into your brain after exposure to these things, are they going to speed up the deposition of this amyloid beta? Are they going to potentially contribute to the development of Alzheimer's disease in these people? And our findings were very significant. We expected some things based on some anatomical studies that were done on people after they unfortunately passed away from Alzheimer's disease. Looking in the inside of these plaques, it's already been proven that several of the common viruses and bacterial toxins are in there, but there were some other really important additional things that we found.
Yes. The findings actually were about that the antibodies made against amyloid beta reacts or cross-react with all those pathogens which started talking about them since 1980s.
Right.
It was demonstrated that many pathogens playing a significant role in Alzheimer's disease. Another meaning, they found some of these pathogens or their antigens in the brain of Alzheimer's patients, of course, after unfortunately died from the disease.
Right.
So in our research, we found that antibody made against these pathogens cross-react with amyloid beta.
Right. So
Another meaning, we are showing that the antibodies made against these pathogens can, if cross the blood-brain barriers, contributing to the pathology of the disease.
So there's two ways in which the infection, what we're saying, there's two ways in which the infection can contribute to the deposition of amyloid beta and therefore the progression or development of Alzheimer's disease. Number one, it's if the pathogen, the virus, makes its way into your brain directly. The whole function of amyloid beta is to bind to it and to protect us from it. And then another way that this can happen is if, as your body is exposed to this virus and it produces antibodies that are meant to protect us from it, those antibodies theoretically can also propagate the formation of this beta amyloid. So things that are designed by your body to protect you are potentially contributing to the development of Alzheimer's disease?
That's a definition of autoimmunity.
Right.
So Alzheimer's disease has a major autoimmune component.
How interesting, right?
Yes.
And the more and more research we're doing into so many neurodegenerative diseases, we're finding that there's a significant autoimmune component. Alzheimer's is now the latest one, okay?
Yes.
So are these detectable things? Can you look for these in
Yes,
your
we
serum?
can look, and actually, let's summarize. We showed that all those pathogens which were reported involving the brain, now we show that antibody reacts or cross-react with them. Borrelia burgdorferi, which is an agent causing Lyme disease.
Correct.
H. pylori,
Right.
causing ulcers.
Yeah, linked to gastric ulcers.
Some viruses such as HSV,
Right.
chlamydia, possibly mycoplasma,
Right.
and others that were shown also influenza.
Right.
And the part that we added to this equation was that it was shown E. coli and LPS, the toxin produced by E. coli, was found in the brain of Alzheimer's patients.
Right.
That's by the group at UC Davis.
Right.
But now we show that antibody produced against LPS, E. coli, Salmonella, Shigella, Campylobacter jejuni,
Right.
which is, as you know, is involved in Guillain-Barré syndrome, but here we see also is involved in Alzheimer's disease.
Sure.
Furthermore, another toxin that people do not talk about it's called bacterial cytolethal descending toxin. This is a toxin 10 times more toxigenic, cause damage to our DNA, can induce tumor in the colon.
Right.
So that also we showed that involved in the Alzheimer's disease because antibodies against those reacted with beta amyloid, the same antibiotic which is supposed to protect us, now antibody made against our oral pathogens, other pathogens, our gut bacteria, contributing to Alzheimer's disease.
Right. So to summarize, these bacteria that we're talking about, E. coli, Shigella, Salmonella, these are bacteria that are really mainly associated with acute intestinal illnesses. Maybe you're traveling abroad and you happen to eat something that wasn't prepared the proper way and you get an acute infection, unfortunately significant diarrhea. These are the bacteria that we're talking about, and their associated toxins can, for some individuals, migrate into the brain. And if you're also producing antibodies against those toxins, those antibodies, though they're designed to help you, can actually also set you up and contribute to the development of Alzheimer's disease. Now, that doesn't happen for everybody, right? That's a very important point here.
That's the message of our another article, which is the third article, or even in the second article that we are going to talk about it. So we have the blood-brain barriers,
Right.
which are protecting us. Okay? These are the gatekeepers of the brain.
Mm-hmm.
Because as you know, that only small molecules can cross the blood-brain barriers. But unfortunately, if we are under stress,
Right.
Antibiotics, other medications, lipopolysaccharides, the same toxins produced by the gut bacteria can open the blood-brain barriers. Now the gate is open and unwanted molecules, microbes, food antigens can penetrate the blood-brain barriers and set the stage to autoimmunity in the brain, including Alzheimer's and other neurodegenerative disorders.
Got you. So for the vast majority of people, if you're relatively healthy, you're exposed to E. coli, for example, you get an acute illness, it goes away, whether you're treated for it or not, and because you have these blood-brain barriers that are surrounding the tissue of your brain, you won't theoretically have any issues with this. But these days, breakdown in the blood-brain barriers are happening more and more than they were in years past, and that's because things like chronic stress, chronic exposure to environmental toxins or chemicals, and even some physical trauma. You know, it turns out in players who happen to have had several even mild concussions or mild repetitive injuries in soccer or football, or whether you've had maybe a fall or a car accident. These are all things that predispose you for these barriers to be open. And the issue occurs when you have these antibodies after the exposure and when these barriers are open. Now, is this something that's detectable as well, to detect whether your blood-brain barriers are open?
Absolutely. When the blood-brain barriers break down, there are molecules and structural proteins in there get released, and the immune system attacks them, and we produce antibodies against them, and those antibodies detected in the blood, which indicates breakdown in the blood-brain barriers.
So this is tremendously powerful in the spirit of switching our focus and our idea of Alzheimer's disease to trying to treat it after the disease has already begun, after symptoms are already present, which after billions of dollars of research has proven ineffective in the pharmaceutical world. We're switching our idea. Let's detect what is actually potentially setting you up for the development of this protein beta amyloid. Let's detect whether your blood-brain barriers might be open. And if they happen to be factors that are present for you, these are things that you can do something about them. You can think of this as a fork in the road, essentially. So if you're 50 years old and you might have a family member or a friend who has unfortunately been stricken with Alzheimer's disease and you've seen those devastating effects yourself, it's important that you understand that we're getting to the point, we're very, very close actually to the point where you can get a simple blood test and find out if any of these factors that are going to set you up potentially 15 or 20 years down the road for having Alzheimer's yourself, these are things that are detectable in the very near future.
So if I will summarize that, actually we call these predictive antibodies.
Yes.
Predictive antibodies are antibodies produced against environmental components and our body tissue proteins. And so those could be detected 10 to 15 years before the onset of disease, in this case, Alzheimer's disease. So these tests are not for diagnosis of Alzheimer's disease. They are good to show that environmental factors that are contributing to Alzheimer's disease are present. Therefore, by removing from the environment of the patient, we can prevent Alzheimer's disease in the future. So our message is for those who are probably not my age, your age, Elroy, individuals who are 30s, 40s, and 50s, they can do something about by changing their lifestyle. That's why these days, as you know, you went to many conventions and medical meetings talking about lifestyle medicine.
Right.
So if you apply lifestyle medicine to Alzheimer's, you can prevent Alzheimer's disease in the future.
And that's incredibly important because we're looking at a doubling in Alzheimer's disease in the next 10 or 12 years. And when we talk about the numbers behind Alzheimer's in the United States, they're very scary. On its own, we're looking at Alzheimer's potentially bankrupting the Medicare system in the next 10 years. If it were the only disease that Medicare were responsible for taking care of, this is ignoring diabetes, heart disease, cancer. Alzheimer's on its own has the potential to bankrupt Medicare. This is something that we really need to start wrapping our heads around, that prevention and lifestyle changes are going to be the answer to Alzheimer's disease. A pill is not going to be the solution.
So in the first article, we demonstrated that pathogens are involved in Alzheimer's disease, and antibody from the gut can also cross-react with those, and therefore we have to pay attention to our gut and also the pathogens in the brain.
Right.
That's number one. Number two article, we found that toxic chemicals and food contributes also to this cascade of inflammation and autoimmunity in Alzheimer's disease. That's why our message is not only try to treat the pathogens or remove the pathogens, also toxic chemicals and certain foods that will, I can name those foods that we publish in our article. And so therefore, If you remove the triggers and your body will make less antibodies, you can prevent Alzheimer's disease in the future.
I love it. I mean, fantastic information. Why don't we talk about those specific foods? Let's talk about our data. Let's talk about the specific foods and the specific environmental toxins that we found can theoretically contribute to the development of amyloid beta in the brain and therefore Alzheimer's disease down the road.
So again, the title of the second article. Immune reactivity of anti-amyloid beta peptide 42 specific antibody with toxic chemicals and food antigens. That by itself is a very strong statement. And again, we knew about the role of toxic chemicals, mercury, food dyes, aluminum,
right.
Bisphenol A, plasticizers,
right.
and other toxic chemicals. We knew about that,
right.
but we didn't know anything about foods.
Right.
So therefore here we are showing that certain foods that I'm going to read or name them are involved in the induction of Alzheimer's disease if we do not digest that food properly. And our immune system will react against that. We make antibody against that food, and now those antibodies turning against our brain, attacking the brain, and after many years may induce Alzheimer's disease.
I'm excited to hear about the foods.
Egg yolk.
Okay.
Then pea protein.
Sure.
That in so many products.
Yeah, pea protein is a very, very common protein to be seen in many vegan proteins these days. Maybe I'll talk about this in a separate video, but very briefly, there are some concerns about vegan proteins. Not only do they have a large amount of pea protein in them, and there's some question as to whether there are significant lectins in that pea protein or not, but it also turns out when you study vegan proteins in general, they have a much higher amount of heavy metals in them and much higher amount of toxic chemicals in them. And that's probably because of where these things are sourced. You know, the pea proteins that are used are not non-GMO organic peas. And even in, I think, best case scenarios, if you're able to find those, because of the contamination of our soil, like the contamination of so many things in our world these days, these proteins, as they're concentrated into powders, tend to carry with them much higher levels of these toxic chemicals.
Yes, as you mentioned, pea lectins is another one.
Right.
So lectins and agglutinin. The next one is lentil lectins.
Yes.
So let's say something about lectins and agglutinins, and probably we'll have special episode about this because this subject deserves one episode.
Yes.
Why? Because lectins and agglutinin are in so many foods. Even potatoes has lectins and agglutinins.
And there are
tomatoes.
There are some practitioners out there that I think have made themselves famous or infamous in some ways in kind of picking one food or one disease and that being the universal problem for everybody. And there, you know, lectins has become one of that hot topics of conversation. And it's certainly true through our research that this can be an issue for some people, but not for everyone. And this is something that you can detect, right?
Yeah, it all depends on our digestive enzymes.
Right.
You and I, we can have the same food. If our digestive enzymes in one person digesting that food properly, no problem. But in another person, those digestive enzymes, if they will not digest that food, then that food antigens become the target of the immune system. We make antibody against them. Now the antibody is attacking our tissue, in this case, our brain.
Would you mind giving everyone an explanation as to what lectins and agglutinins are?
Yeah. Lectins and agglutinins are glycoproteins.
Okay.
Meaning protein and sugar molecules bound together, and the plants are making them as kind of protection against viruses or bacteria in the nature.
Right.
So many foods make lectins and agglutinins, which are glycoproteins.
Right.
So when, for example, let's take beans. Beans have the highest levels of lectins and agglutinins. When consume beans, obviously they have to be cooked properly.
Extremely well.
Yeah. If we'll consume raw beans, we'll be in a hospital within 30 minutes.
Yeah, it's a big problem.
Because
for a
of
lot
the
people.
lectins and agglutinins that can bind to the receptors
Got you.
in the gut, to the epithelial cells, to the bacteria in the gut, making the bacteria to produce all those toxins, lipopolysaccharides, bacteriocytolethal distending toxin. And so lectins and agglutinins make the bacteria to produce more toxins, and the toxins causing diarrhea and opening up blood-brain barriers, and eventually possibly Alzheimer's disease.
So a problem definitely for some people, particularly if you aren't cooking or soaking your beans and other foods, but not a problem for everybody.
Yes,
Okay.
that's correct.
What other food categories do we
Okay,
find?
so then we have some cashew, hazelnut,
Okay.
and then the two major ones, the strongest reaction actually, or three, milk, casein,
Okay.
and wheat, alpha-gliadin, and other components of wheat.
How interesting.
And finally, the most fascinating, and this is the most fascinating part of our finding, is when we took tuna,
Raw tuna.
Yeah, raw tuna, we found like about 20% reaction.
Okay.
But when we took canned tuna,
Right.
from 20% went up to 80%.
Wow.
So what is the reason?
Well, canned tuna is cooked in the can, right? And there are several toxins that come along with cooking in the can, right? Many of the cans are lined with bisphenol A, and the cans are mostly aluminum, right? So three things. You're cooking the tuna, so you're changing the composition of the protein, right? For raw versus cooked, the proteins are different. And you're putting a bunch of BPA and a bunch of aluminum attached to that protein, and all of a sudden your body reacts to it like crazy.
Absolutely. That's excellent, excellent explanation.
So if you could pick three foods that most people, if they would potentially have an issue with these leading to the development of Alzheimer's disease, it's dairy, it's gluten, and it's canned tuna. And these are not theories and based on observation anymore. Now we kind of have mechanisms to prove their reason for removing them in Alzheimer's disease.
Well, I will even extend that to any canned food. I'm sorry.
Okay.
Okay? Because imagine if you have beans, which contains so many proteins, lectins and agglutinins, and now you have them in the can, and the aluminum from the can, the bisphenol A, binds to those proteins, making them more antigenic.
Sure.
We react against them strongly.
Okay.
And so therefore, I would like to extend that to any canned food.
So canned foods, dairy, and gluten off the menu for anyone.
Lectins and agglutinins.
Lectins and agglutinins for anyone who is potentially dealing with Alzheimer's disease or has a significant family risk factor for the development of Alzheimer's
Yeah.
disease.
So that will take us to the next subject, which is aluminum,
Right.
like toxic chemicals. The binder that you showed earlier, in that binder there are at least 50 different articles.
Right.
Actually, the title of one of those articles is Aluminum is Neurotoxic.
Right.
What is the meaning of aluminum is neurotoxic? It's toxic to our brain.
On its own, aluminum, if there was nothing else going on in the body, aluminum has the ability to kill nervous system tissue and in your brain. And there are other very good articles that identify aluminum as an independent risk factor for the development of Alzheimer's disease. So what that means is, this is very well established at this point, if you take two groups of people, one group that is exposed to higher amounts of aluminum through their environmental exposure, cooking things in aluminum tins, storing things in aluminum containers, using deodorants that have aluminum in them, using other beauty products that have aluminum in them. If you do this every day for your entire life versus a group that minimizes their exposure, the group with the heavy aluminum exposure absolutely has a much higher rate of Alzheimer's disease. So we know aluminum is no doubt a higher risk factor, but we didn't know exactly why, right?
Yes, exactly. So, but also everybody should know that unfortunately aluminum is in many foods.
Yeah.
And the assumption was or is that aluminum added, for example, to cheese
Yeah.
is in and out.
Right.
But in reality, that's not the case. Aluminum in cheese or other foods, cosmetics, get into our body, in the gut, goes to the epithelial cells. In fact, is one of the major risk factor for Crohn's and ulcerative colitis, aluminum. And now there is evidence that aluminum is detected in the brain of Alzheimer's patients.
Yeah.
So isn't that wise not to consume any food which contains aluminum?
I'm going to give you credit because this might be recent research in the eyes of some, but 15 years ago, you made me remove all the aluminum from my house, and I don't think I've seen a piece of aluminum in your house for maybe 20 years, so
Yes.
You've been on top of this for a long time.
Yes, so please, you guys do the same.
Yeah.
So the next is mercury.
Yes.
Also, so what we found actually, the same antibody that reacted to pathogens, the same antibody reacted to aluminum, bound to human serum albumin,
So our own tissues.
our own tissues, mercury bound to our own tissues, phthalates, which is the plasticizers,
Right.
bound to our tissues, and then dinitrophenol is another one, which is benzene ring
Yeah.
structure,
Phenol rings.
such as phenol ring, which is in many cosmetics and many other products.
Right. So further evidence that, for some people at least, we have some unknown exposures in our environment that seem silent and harmless, but, maybe slowly potentially poisoning us. And in this case, looking like there's pretty significant evidence that these things, especially plastic, mercury, aluminum, are contributing to the development of Alzheimer's disease and are at least a partial contributor to this major boom and rise that we are experiencing in Alzheimer's disease in the last decade or so.
Yeah. So in the third article, we wanted to see if patients with Alzheimer's disease and healthy individuals, do they make antibodies against food? Do they make antibody against toxic chemicals? Do they make antibodies against the pathogens? The answer was yes.
Okay.
Yes. Maybe a little bit more in Alzheimer's patients.
Right.
But healthy people also make antibodies, meaning we are exposed.
Right.
We are exposed to pathogens, we are exposed to toxic chemicals, and we are exposed to many foods that are undigested, or many food molecules which are undigested, such as lectins and agglutinin.
So taking care of your gut and taking care of your brain is the most important thing that anyone could probably do.
Absolutely. So these antibodies can circulate in our blood, as we mentioned earlier, but this is the heart of the third article,
Okay.
that these antibodies circulate in the blood unless something happened to the blood-brain barriers, and those antibodies cross the barriers, no harm is done. But as soon as something happened to us and blood-brain barriers get open, the gut is producing too many toxins. The toxins opening the blood-brain barriers, then the gateway to neurodegeneration is open, and those antibodies and antigens and toxins all together causing inflammation in the brain, and that's the end product, which is the amyloid plaque.
How fascinating.
So this is the summary of the third article. So the final message from all these three articles, yes, all of us are exposed to these three environmental factors: pathogens, infections, toxic chemicals, and undigested food antigens. Some of us, we make antibodies, some of us more, some of us less, against these three factors. These antibodies can circulate in the blood for so many years until blood-brain barriers get damaged and then can initiate Alzheimer's disease. So if these antibodies are detected in the blood for many years, our message is we can detect these antibodies at very early stage, we can take preventive measures. If they are pathogens, we can treat them.
Yes.
If there are gut bacteria, we can treat the gut. If these are environmental toxins, it's easy to remove them. For example, I'll give you the best example. Your favorite pizza. What do we have in that favorite pizza? You have the gluten.
Right.
You have the cheese
With aluminum.
with aluminum.
Okay.
You have the tomatoes with lectins and agglutinins.
Okay.
So when you enjoy that, I will tell you that if you have antibodies against any of those, you cannot enjoy that anymore. And so you have to change your lifestyle based on your antibody print,
Right.
antibody signal, I call that,
Yeah.
or signature.
Yeah.
So based on your antibody signature, you have to remove those factors from your environment, from your diet, change your lifestyle, and believe me, you may prevent Alzheimer's disease in the future.
I got you. So we're going to summarize a little bit now. We're going to talk about what we talked about in episode 6, which is really a lot of Dr. Bredesen's work, a lot of our work combined with it, talking about our V factor for brain health. And we'll talk about what we, incorporated in episode 7 in today's episode, that through our research, we're really pushing the frontiers of individualizing immune risk factors for the development of neurodegenerative diseases like Alzheimer's disease. These are things that are readily detectable, and these are things that you can do something about. So if I'm walking into a functional medicine practitioner's office, I want to make sure, number one, that they have been taught by Dr. Bredesen and they are a certified RECODE practitioner. I am very lucky to have been in one of Dr. Bredesen's first groups. I am also very lucky to have met him and chatted with him and his wonderful wife, Aida. And I am one of those practitioners. I'm happy to help you out if necessary. We have many patients who are enrolled in this program so far. And I think also, more importantly, there are some everyday things that really everyone out there can do to help themselves prevent Alzheimer's disease and neurodegenerative disease. And that's our V factor for brain health. So I'm going to bring that up one more time. So on the left of the V, we kind of have the descending staircase into neurodegeneration and potentially Alzheimer's disease. On the right, we have the things that you can do about it to help yourself prevent these things or heal from any neuroinflammation that might have been occurring for you. So I'm going to talk about the right side.
Please.
So on the right, we have all the things in the V factor that you can really do to help your brain health, help prevent Alzheimer's disease. And a lot of these things have been in the news lately because Dr. Tansey from Harvard recently published an article in Science talking about how walking is probably the most important thing that you can do to develop an increased amount of something called BDNF, which is the chemical in your brain that encourages healthy neurons to grow and can really help decrease your chance of Alzheimer's disease. And I've said it many times before, if there's one thing that you do, please walk 4 or 5 times a week. Shoot for 40 minutes to an hour every day. That's one of the most important things you can do. But let's go through the rest of this list. So we talk about removing environmental triggers, which is the spirit of everything that we talked about today in episode 7. We can specifically detect what those triggers might be for you and help guide the elimination of them. So as you mentioned, if it's a toxin, if it's a bacteria, those can be treated. You have to accurately be able to detect those things first and make sure that you're not just shooting in the dark. Low impact physical exercise, which is what Dr. Tansey talked about and what I just mentioned. Walk every day.
And by the way, in relation to that because BDNF is so important, we showed in our study that patients with Alzheimer's, even some healthy people, make antibody against BDNF.
So they're destroying their own
levels.
levels.
It's so important, it's so important to walk and replenish the BDNF.
Yes.
It's very easy, just walk every day.
We have on the next level things that you can do to enhance neuroplasticity. So enhance your neurons' ability to be as functional, as fluid as they possibly can be. These are things like brain games, mindful meditation, yoga. If you do these things, you're really helping your brain out, not just your body out. Glutathione, one of my favorite amino acids, master antioxidant, is one of those things that's really good at decreasing inflammation in the brain, helping to restore blood-brain barrier integrity. We talk about healthy fats, fish oil, very clean olive oil, in some cases coconut oil as well, but really olive oil, avocado oil, and fish oil, making sure that your fish oil is from a very clean source that has been tested for chemicals, right?
No mercury.
No mercury. And the next step, probiotics and prebiotics, things that are designed to take care of the immune system in your gut, take care of the composition of bacteria in your gut. Make sure that if you are exposed to something like E. coli, that its effects are not so severe, right?
Yes.
Vitamin D and melatonin, vitamin D, as I mentioned last time, is a hormone, as a matter of fact, not a vitamin, and it's one of the most important signaling molecules to your brain. If you are going to take vitamin D, unless you're on a blood thinner like Xarelto or Coumadin, you also want to make sure that you take it with vitamin K2. I like K27, so that ensures that the calcium that is being pulled from the vitamin D gets deposited in your bones and not in your arteries. It's a very important thing. Melatonin. Melatonin is actually an antioxidant signaling molecule, not just something that induces normal sleep. So that's also very important for brain health. A very small amount of melatonin at night, 2 milligrams right before bedtime, is a very healthy thing for those that might be suffering from issues related to brain health. Resveratrol, curcumin, ginkgo biloba, quercetin, and ECGC, which is an extract from green tea, right? So these are all phytonutrients, antioxidants, things that really help support the overall health of your brain, decrease the inflammation that might be affecting both your gut and your brain. So again, resveratrol, which is from grapes and wine, curcumin, ginkgo biloba, ECGC, which is an extract from green tea. Then we have another group of nutrients, alpha lipoic acid, L-carnitine, CoQ10. These are things that are very helpful for your mitochondria, making sure that the energy cells in your brain are functioning appropriately. They also have some anti-aging properties, in particular CoQ10, another thing that's also very good for your liver. And at the end, we have a few supplements that have had some significant research behind them in also being able to increase the production of that signaling molecule BDNF, or signaling hormone BDNF, and that's Chinese skullcap and my favorite, nicotinamide riboside, also known as niacin, very easy coenzyme to take every day that increases your ability to create healthy, maximally functioning neurons in your brain.
Thank you for that summary. I would like to emphasize that every single item that Elroy mentioned, we have several articles about published in different scientific journals, including Journal of Alzheimer's Disease. So if you would like to see the evidence and read about it, go online. And in Journal of Alzheimer's Disease, you will find some of those articles. But I brought also two with me because that issue was from A to Z.
Yes.
Okay? From vitamin A and then to zinc. So here, that something about vitamin C. We have the notion that vitamin C is only good for prevention of cold. But believe me, this article in Psychology Today emphasizing how much is important to take daily dose of vitamin C, because vitamin C is protecting you against Alzheimer's disease. The dosage of vitamin C that they are telling or mentioned in the textbook of biochemistry is for prevention of scurvy. For many years, I did research on the role of vitamin C in enhancement of natural killer cell cytotoxic activity, which plays a role in killing tumor target cells and viral infected cells. But now, this is new to me, that vitamin C is protective against Alzheimer's. How much? 500 milligrams a day. Not 100 milligrams, which is good for prevention of scurvy. 500, and some people take 1,000 milligram a day in a chewable form. So that's one. The second, and this was in Psychology Today. The second was an article in Proceedings, National Academy of Science, you know, one of the best journals in the world. And what is the title? Preventing Alzheimer's Disease Related Gray Matter by Vitamin B Treatment.
Yeah.
So these are kind of titles that supporting your V factor, and you guys should know about all of this is evidence-based medicine.
I want to take a second because B vitamins is a very complicated topic, and I want to say that B vitamins really should be individualized, and you really want your B vitamins to be catered and crafted for you by a trained functional medicine doctor. We have some genetic variants that kind of change how we can use and utilize the B vitamins we're exposed to. But in general, you want to be very careful about the type of folate that you're taking. And you know, I'll throw a plug for our new supplement line here at Regenera Medical. We carry what I think is the best B complex in the market. We call it B Supreme. It's very well balanced. It's designed to reduce something called homocysteine, which this article talks about being one of the independent risk factors for the development of Alzheimer's disease and the loss in the memory center of your brain, the hippocampus.
And Elroy, by the way, mentioned because high homocysteine is involved in cardiovascular disease, mainly in the females,
Yes.
which have also more Alzheimer's.
Right.
So connect the dots.
So come to the clinic, pick up some B Supreme. It's really helped designed for this specific reason, improve your overall cardiovascular health, and
Prevent Alzheimer's.
Prevent Alzheimer's disease in those patients as well.
So the final message.
So we have one final concluding message that kind of wraps up our overall discussion of Alzheimer's disease. And that's essentially, if you have memory loss, it's going to get worse if you don't do something about it.
But
right?
don't wait until you have memory loss.
Right.
Our message is this.
Yes.
Do all these steps when you are healthy.
So, number one, your diet and lifestyle affect your microbiome, right? So what you eat and how you live changes your microbiome for the better or the worse. So if you eat a healthy diet, organic foods as much as possible, a diverse amount of foods, and you do your best to minimize the impact of stress on your life, your gut microbiome will be as healthy as possible. A healthy microbiome leads to a healthy immune system, right?
Yes.
And your immune system changes your brain. Everything that we've been talking about today has been about all of the new research that shows that beta amyloid is a protein that's involved in immune function of your brain. And then the immune system that is functioning in your gut and your blood also affect your brain.
Yeah.
So,
in fact, last month's issue of Scientific American, the cover was about the seventh sense. The seventh sense, meaning connection between the immune system and the brain. That's exactly what you are saying.
right. And most importantly, so your immune system, if it's working positively, can affect your brain in positive ways. Your brain, when it's functioning appropriately, affects you in positive ways. So the question is, how can you change? You know, I think there's a tremendous amount of information in our last two talks, including today. You can get personalized assessments if you go to the right person that can kind of guide you and make sure that you're making the correct moves, making the correct decisions on a daily basis.
Thank you, Elroy.
Thank you,
and
Dr.
I
V.
really appreciate, I'm very proud of you, what you do for your patients. I never had the chance to tell you, but since you got involved in functional medicine, that you are helping people, and I thank you for that.
I appreciate that. It's a tremendous honor and honestly the most fulfilling thing that I've ever done in my life to be able to help these people in these meaningful ways, and I look forward to helping more people in the future. Thank you very much.
Thank you. Thanks.